members. Health education provide करेंगे. Okay, one thing. Can you give a specific example how they can involve? Okay, you have a neighbor, and the neighbor have a child. Okay, less than 5 years now. Okay, the child started developing some sort of disease condition, and they are continuously following home remedies. Cough, cold, or more than 2 weeks, more than 3 weeks, they are not taking the child to hospital. They are continuously following home remedies. You eat this particular medicine, you eat this particular leaf, ye wala pani piyo, only home remedies they are following. Is it good or bad? Why? They are only seeing cough and cold, but underlying क्या हो सकता है? It can be tuberculosis, it can be lung-related disease conditions. Okay, but they are only following home remedies. So what will you educate them? Will you educate them something? Yes or no? What will you tell them? What will you suggest them? Hospital visit karo. Okay, kindly refer a doctor, that will be good for you. Okay, you have learned about facility-based newborn care, feeding, etc. Okay, आपका फैमिली में एक चाइल्ड का बर्थ हो गया, and the relatives they started giving the baby some pre-lactal feeding. The first day, second day, they are giving the baby honey, they are giving the baby animal-based products, they started giving the baby some sort of semi-solid food. You will educate them something? क्या educate करोगे? I will let them do it, no problem. No? You have an idea? You will educate. Okay, you are not supposed to give any pre-lactal feeds until and unless the baby has come to the weaning period, right? So in such a manner you can involve the family members or the community by providing health education, or by demonstrating, or by sharing your experience. Okay, so that the conditions can be prevented. Once they come to the hospital, आप क्या करोगे सर? Manage कर सकते, otherwise treat कर सकते. But when you are getting the involvement of the community members or the family members, in the first place itself you are trying to prevent it. The principles of IMNCA: assess the sick under 5 for urgent referral. Okay, you can see the doctor or the nurse is auscultating the child. Immediate assessment, head to toe examination or specific signs manage करना है. Then regularly check kids for symptoms, nutrition, immunization, feeding and potential issues. Regularly check मतलब how can you regularly check the baby's condition? Day by day एक एक घर में जाके वो assessment कर सकते हैं क्या? No. You will get some time when the baby is coming to the hospital, especially when for immunization. ठीक है? More than, ठीक है, on an average मान लो they are coming to the hospital for immunization 5 times. ठीक है? You are getting chance, you are getting an interactive session with the baby or the child. There itself you can perform the assessment. ऐसा नहीं कि पूरा head to toe assessment करना है, but मान लो you are the one who is giving the injections or vaccination, vitamin A या K जो भी है vaccination या immunization आप provide कर रहे हैं. What is your duty or responsibility? बेबी आ गया, okay, उसका record में tick मार दिया, gave the vaccination or gave the immunization, send them back. No, you are getting a chance, right? What will you observe? Is the baby's weight? You will check the weight before giving immunization, right? Okay, why it is done? You are comparing, is the baby's weight accordingly, is it same or good with the age of the baby? ठीक है, 3rd month है तो बेबी का weight क्या है? Is it good or bad? Overweight है या underweight है या malnourished है? You are exposing the baby's cloth for giving the injections. ठीक है, deltoid muscle और thigh जो भी है. Then you are seeing यहाँ पे muscle wastage है. You can see the rib cage, it is baby is severely wasted. So what is your आपका assessment part हो गया, right? Okay, you can see that the baby is malnourished, baby is not getting enough feed. You are opening the mouth of the baby to give the syrup, vitamin A syrup, and you are seeing that mouth के अंदर बहुत सारा lesions present है, ulcer formation present है, bleeding present है. So you are getting a chance to regularly check the baby, no, and immunization part is just an example where you are getting a chance to assess the baby's condition. Then use specific signs for disease detection. Matlab, different diseases can have different signs हो सकते हैं, but they also might have the common signs and symptoms. Okay, I have already told you the baby is having viral infection, they will have fever. If they are having bacterial infection, still they might have fever. Okay, but you are not going to specifically focus on it. So, okay, fever भी है, vomiting भी है, तो it can be particular condition. Fever भी है, उसके साथ baby is having diarrhea, so it can be related to stomach or digestive system. Specific signs आपको देखना पड़ेगा. Here you can see a simple image where the baby is having itching or rash. ठीक है? So it can be related to different conditions. Either it can be due to skin irritation, allergy or food poisoning भी हो सकता है. Baby came in contact with some allergens or toxins, उसके वजह से भी हो सकता है. You are not going to specifically treat that. You are going to generalize it. अच्छा, ये भी हो सकता है, तो उसको specific sign क्या है वो देखो, उसके according treatment provide करो. Classify children based on signs for treatment and diagnosis. Same like I have given the example of trial, you have to classify the babies according to their severity of condition. IMNCA covers common pediatric issues related to respiratory conditions, heart related conditions, digestive system related conditions. Use essential drugs sparingly. Meaning, you are only going to prescribe drugs at the proper dosage, at the proper frequency. ठीक है, OD, BD जो भी है proper frequency में proper medications provide करें. Because for babies under 5, if there is any change in the dosage or गलत medication दे दिया तो body can develop. Baby was having viral fever, आपने antibiotics prescribe कर दिया, क्या होगा? First of all, there is no use. Second of all, baby's body will develop infection? No. Resistance. Because the baby's body will develop resistance against that medication. Then in the near future, if they have any bacterial infection, the same medication will not show any effects. वहाँ पे आपको higher doses देना पड़ेगा. That's also a problem. ठीक है? Involve caretakers in the child treatment and counsel caretakers on home care and when to seek help. ठीक है? You can see the process. First one is assess करना है, check for a range of childhood condition. Second one, IMNC algorithm follow करना है so that you can segregate the conditions. And the third one is treatment provide करोगे या referral provide करोगे, depends on the type of assessment you have performed. I have told you there are two type of interventions. First one is curative interventions and preventive. Curative मतलब once the disease condition has already occurred, you are trying to treat it or cure it. Few examples: acute respiratory infections, anemia, diarrhea, ear infection, HIV, localized bacterial infection, meningitis, malnutrition, wheezing. Wheezing मतलब sign of any sort of respiratory distress or failure, malaria, measles, neonatal jaundice. And then comes preventive interventions. Okay, maximum to maximum you are trying to prevent something from occurring. So what all things you can include? Proper breastfeeding support, proper timing by immunizations, nutritional counseling according to the baby's diet, मतलब baby's requirement, high protein diet देना है या high fat diet देना है, weaning time पे which type of food you can include or which type of food you should exclude, periodic deworming, vitamin A and zinc supplementations. ठीक है? And you can see over here the case management process का step 1, assess. Okay? Communicate with the mother or the caretaker or the family members, screen for any sort of danger signs, ask about common conditions with which the baby had previously focus on physical examination, assess nutrition and immunization, check for other health issues. आपका basic assessment part finish हो गया. Then you are going to segregate. You can consider, okay, I am using the word segregate or separate the baby according to their conditions, severity. You can see pink, yellow and green. Pink indicates urgent referral. ठीक है? Green, yellow indicates treatment required and green indicates ठीक है, इतना severe नहीं है, medications हम provide करेंगे, you can go back to home and वहाँ पे भी आप ट्रीटमेंट कंटिन्यू कर सकते हैं. ठीक है, यू गो टू हॉस्पिटल विथ नॉर्मल कफ एंड कोल्ड, डॉक्टर विल प्रेस्क्राइब सम मेडिकेशंस. क्या बोलते हैं, ठीक है, डेली 2 टाइम्स आपको स्टीम करना है, ड्रिंक लूकवार्म वाटर, डाइट में कुछ चेंज करना है, यू कैन गो बैक. ओपीडी विजिट हो गया. अदर वन, यू आर गोइंग विथ सीवियर डायरिया, सीवियर हेडेक, सीवियर वोमिटिंग, क्या बोलते हैं, ओके, होम रेमेडी से कुछ ट्रीट नहीं होगा. नर्स इमीडिएटली स्टार्ट विथ IV फ्लूइड, एडमिट द पेशेंट. And you are going to the hospital with a severe head injury or after an accident, normal admission procedures finish karoge? No. Immediately you will be shifted for any sort of surgery if needed or to the ICU. अगर वो hospital में उसका setup नहीं है तो next hospital में shift करेंगे. Same scenario. Step 2, उसके according baby को हम classify करेंगे. As you can see over here, pink means severe classification needing admission or pre-referral treatment and referral. Yellow indicates classification needing specific medical treatment and advice, and the green one not so serious and in most cases drugs का भी जरूरत नहीं पड़ेगा. ठीक है, in case drugs अगर देना है, proper health education provide करेंगे, then they are sent back to home. ठीक है, identify the treatment, and the fourth one is treatment. According to the condition, एक proper treatment plan आप prepare करोगे, then accordingly you are going to treat that one. Then after treatment let them go? No. Counsel, किसको counseling करना? Parents, family members. ठीक है, teach when to return for follow up. Follow up is also a part. When to return बताओ. कब बोलते डॉक्टर come back for next visit? When? Take this medicine for 3 days. ठीक है, अगर रिजॉल्व नहीं हो रहा तो come back on this particular day. Right? Then when you come back क्या होता है normally? Either doctor will change the medication or will change the dosage, or dosage भी change करेगा. Otherwise the doctor will either change the complete medication, otherwise एक नया treatment plan आपके लिए implement करेगी. Same. And sixth one is follow up. Some need multiple visits for illness, other offer follow up as per the guidelines of the hospital and reassess for new issues when they are coming back. Okay, first of all I went with the complaints of runny nose, cough, cold. Doctor prescribed some medication, I came back, took the interventions, nothing resolved. I am going again back to the doctor, then reassessment. Okay, doctor will ask, are you having any other problems additionally? Then I might say back of the throat will pain, or I started developing breathing difficulty also. ठीक है, you are not going to just simply he is thinking okay previously he was having this problem, okay वही problem के लिए मैं कुछ medication या treatment plan करेंगे. No, reassessment is also important when coming for follow up. Okay, this is the main portion of IM and CI. So principles clear है, objectives, the aims, and the main thing is classification, how to segregate or how to classify babies or children according to their condition, mainly into 3 categories: pink, yellow and green. Pink indicates urgent referral or treatment. ठीक है, urgent referral, not only urgent referral when that facility is not having such resources, or at the referral at the facility refer करेंगे. You are going to the general OPD, वहाँ पे दे दिया जो the doctor is saying ठीक है, this particular case you have to refer for the, you went to a doctor, ठीक है, MBBS MD, then he explained your problem, ठीक है, द डॉक्टर इज सेइंग ओके यहाँ पे दूसरा हमारा एक डॉक्टर है, ही इज स्पेशलाइज्ड इन यूरोलॉजी और गैस्ट्रोएंटरोलॉजी, वहां पे भी आप रेफर करोगे at the referral in the facility itself. Then come to the OPD or the yellow color, the treatment is given at the OPD, then they are sent back to home or treatment is done at the home clinical setting itself. Day care of both, then at the green one, home management is more than enough with or without medical interventions. Clear with the events here? Okay, take your phone. Have you installed the SimPoint app? Yes, open it. Open. Sign up किया था? Yes. Did you come to a page like this? Are you a nurse or are you a nursing student वाला? Yes. Click on the nursing student. Did you come to this page? Select the mandatory module, click on mandatory module. Click. Okay. I think only fifth sem is having their phone, right? Okay. Just a second. Did you guys see your module? Come down. FNBC, ENBC, IMNCI, PLS. Select, click on that module. Did you open this one? Currently, if you try to open, डिस्क्रिप्शन आपको मिलेगा, कंटेंट्स अभी इसके अंदर ओपन नहीं है, तो क्या करना है, कम बैक, रजिस्ट्रेशन किया था yesterday, सेम, ओपन योर गूगल लेंस, गूगल लेंस ओपन, स्कैन दिस QR, एक गूगल फॉर्म आएगा, उसको आप फिल करना है। अगर किसी का डायरेक्टली स्कैन नहीं हो रहा है तो फ्रेंड्स यू कैन शेयर द लिंक टू व्हाट्सएप ग्रुप ऑल्सो। 6 सब 5 सब लोग नहीं हो रहे, साइन अप select the modules ENBC, PLS, IMNCI, then you can submit it. Class representative gonna be sir. कॉमन व्हाट्सएप ग्रुप है, काम करो, को कॉमन व्हाट्सएप ग्रुप में शेयर करो प्लीज सब. If you are not able to directly scan, I have shared. Okay, can Divyansh has shared a link in your WhatsApp group. वो लिंक के थ्रू भी आप ओपन कर सकते हैं. Yes. Sign up. Yeah, account. Better. हाँ, मैं आप मतलब जैसे इंस्टाग्राम या फेसबुक में अकाउंट क्रिएट करना है. सबमिट हो गया गूगल फॉर्म. Yes. See, first you have sign up. Those who have not yet signed up, sign up करो, पहले एक अकाउंट क्रिएट करो, then do this one. ठीक है? कनेक्ट करो. गूगल फॉर्म सबमिट हो गया. दैट मीन्स 2 to 3 days के अंदर सेम पॉइंट ऐप में आपको कंटेंट्स अवेलेबल हो जाएंगे. ठीक है. वो ऑर्डर ऐसा है, डे मतलब डे मंथ ईयर आता है. सेलेक्ट करो.